News poll found more than 1 in 5 Americans do not plan to get vaccinated. As LA County is ramping up vaccine efforts, local doctors want to dispel any misinformation.
And joining us live is Dr. Sarah Lopez. She is a patient safety officer at Harbor UCLA Medical Center. Thank you so much and good to see you.
Morning.
Hey, good morning. Thank you so much for having me on today.
Of course, you're always welcome. First question for you. How do we know the COVID-19 vaccines are safe?
I want to tell people, as a physician, a lot of people have asked me, a lot of my patients and even my own parents have asked me, how do you know it's safe? And one of the things I want to assure people is that thousands and thousands of people had been vaccinated as part of these studies, and these vaccines were tested on thousands of people to make sure that they were safe and effective, meaning that they actually did what they were supposed to do, which is prevent COVID, right? Prevent serious COVID where people have to be hospitalized and prevent death from COVID. All three of these vaccines do that exactly.
And Dr. Lopez, you said you even spoke to your own parents. So how do you convince people who think that there's going to be a chip implanted with them or that this is infecting them with coronavirus? How do you convince people who seem dead set against it?
One of the things that I actually started doing even within our own community and within my own staff was I started to talk about the myths, right? And I was really honest. I said, okay, let's talk about the myth about the chip. What we ended up discovering is that actually people were misconfusing one of the syringes that we use to vaccinate, where the needle actually retracts into the syringe to protect the nurse. They thought that the needle was the microchip, right? And so I started talking to people about these concerns and helping them understand how really this vaccine is here to protect us, to protect our community, to help us kind of get out of this pandemic and really get back to normal, right? To be able to open up our businesses and see our friends and go to restaurants and go to theme parks and really start our life again. And I think one of the things that was really beneficial for my own parents, right, was the fact that they were able finally to see their grandkids. I have 3 little boys, and they were finally able to see their grandkids and my sisters once they got vaccinated, right? It really opened up their world, and that's what this vaccine will do. It'll open our community back up.
All right, Dr. Lopez, I know it's been a challenge, but have you been, listening to some of your patients or people in our community who are just saying they just don't want to do it and understand it and hearing their reasons why?
Yeah, no, I have heard. And you know what? The truth is that this was new, a new vaccine, in particular the Moderna and Pfizer vaccines with the mRNA. They were relatively new, but I also explained to them that this research has been around for 30 years, right? It's not something that, just happened over this past year. And actually Moderna had been developing the original SARS vaccine, mRNA vaccine. So once I start talking to my patients and listen to their concerns and kind of start addressing them, it really helps them, just like I do with my own family. And one of the things I want to share is that, I just recently went through cancer treatment. So I went through 6 months of cancer treatment. And I think a lot of people are really concerned because they're like, well, I'm immune compromised, I have diabetes, I have heart problems. I'm really concerned about this vaccine and if it's safe for me. And I tell them, I took this vaccine because even though I had cancer, I took this vaccine because I know that COVID is much more serious and will cause more serious illness in people that are immune compromised, right? And I realized that this was my chance to be able to get out and start doing things again and to be able to safely with my mask, right? So still distancing, but be able to start doing things. And it's really to protect the more vulnerable communities out there. And I think it's really important for us to keep messaging that, right? Keep telling our patients, keep telling our family and friends and letting them know that this vaccine is extremely safe. It's very effective, and it's what's going to get us out of this pandemic.
And Dr. Lopez, you beat cancer. How did it feel to get vaccinated after going through such terrible disease as cancer, but also knowing that you're protected?
I'll be honest. I actually, when Harbor called me and said, hey, Sarah, I was gone for about 8 months, and they said, we have a vaccine for you. I'll be honest, I cried. I was really surprised and really happy because, I had been in this huge bubble. And also when I called my oncologist to let him know, hey, they offered me the vaccine, what do you think? You know, he actually was really surprised. He's like, hey, how did you get a vaccine? You know, how did you get access? But he was like, yeah, you should absolutely take it because it's just mRNA. There's no live virus. You can't get COVID with these vaccines. He's like, you should absolutely take it. His concern was whether my immune system would be strong enough. And I think that's what we have to remember. Even people like me that get vaccinated, 75 to 80% of us have to get vaccinated so we can have that what's called herd immunity, where we protect each other, where we protect the most vulnerable and also our kids that are not yet eligible to get vaccinated.
All right, doctor, thank you so much for sharing your personal story. That was a really good thing, and I hope someone is listening this morning and will take your testimony and say, hey, she did it, I can do it too. And thank you for all that you do for the Black and brown community as well. We appreciate it.
Of course. Thank you for having me on.
Thank you, Dr. Lopez.